Okay, let's dive into something that affects millions of us, but honestly, doesn't get talked about nearly enough. It's called peripheral arterial disease, or PID for short. Now, this is a pretty serious condition that often flies under the radar. So in this explainer, we're going to pull back the curtain on what PAD actually is. We'll uncover some really surprising risk factors, and, most importantly, we're going to explore the proactive steps you can actually take to manage it. Let's get right into it.
So, here's our game plan. First, we'll nail down exactly what PAD is. Then, we'll get into a fascinating link with vitamin D that you might not expect. After that, we're looking at two powerful strategies: healing from the inside out with food and protecting yourself from the outside in with proper care. And finally, we'll wrap it all up into a straightforward, proactive health plan.
Just to give you a sense of the scale here, look at this number. 200 million. That's how many people are living with PAD across the globe. You know, this isn't some rare, obscure disease. It is a global health challenge, and it's especially common for people over 70, where it can affect as many as 30% of folks.
All right, so what exactly is this condition that's affecting so many people? Let's get right to the heart of the problem.
Fundamentally, PAD is a circulation issue. The easiest way to think about it is like a plumbing problem inside your body. You see, over time, plaque can build up and start to narrow your arteries. That process is called atherosclerosis. With PAD, these blockages specifically start choking off blood flow to your limbs, and most of the time, that means your legs and feet.
And believe me, this isn't just about having sore legs. The consequences of that reduced blood flow, a condition called ischemia, can get really serious. It can cause pain that makes it hard to even walk, it can lead to sores that just refuse to heal, and in the worst-case scenarios, it can even cause tissue death. So here's the bottom line. PAD is a major warning sign for your overall heart health. It signals a much higher risk for things like heart attack and stroke.
Okay, now that we understand the problem, let's dig into a really surprising piece of the puzzle. There is a fascinating and scientifically proven link between PAD and a vitamin you might not guess.
Now, what's so powerful about this slide is that this isn't just one study. This is what's called a meta-analysis. That means scientists combine the results from 10 different studies to get a much bigger, more reliable picture. And the conclusion? It's crystal clear. You see that blue diamond down at the bottom? It's sitting way over to the left, which shows that across all of these studies, patients with PAD consistently had significantly lower levels of vitamin D.
And this chart, this really drives home just how strong that connection is. The data shows that people with vitamin D insufficiency, meaning their levels are just a bit low, already have about a 10% higher prevalence of PAD. But look what happens with a full-blown deficiency. The prevalence of PAD shoots up by a staggering 48%. That suggests that low vitamin D isn't just some coincidence. It could very well be an independent risk factor for the disease itself.
Okay, now that we've looked at some of the risks, let's pivot to solutions. And the good news is there are some really powerful lifestyle changes that can make a huge difference. Let's start with an internal strategy, using food to literally heal our arteries from the inside out.
This quote comes straight from a clinical study, and honestly, it's incredibly hopeful. It's saying that real, measurable improvements were seen in patients after just 4 months of changing how they ate. I mean, that is a remarkably short time to see that kind of physiological change. But what in the world is vascular endothelial function?
Let's break that down. Your arteries aren't just stiff pipes. They have this smart, active inner lining called the endothelium. Think of it like the non-stick coating on a high-tech frying pan. When it's healthy, blood just glides right through. But when it gets damaged, things start to stick and cause those blockages we talked about. So improving your endothelial function means you are literally repairing that delicate inner lining, making your entire circulatory system work better.
So what does this artery healing diet actually look like? Well, it's not about restriction, it's all about abundance. You can see right here the whole foundation is built on whole foods. A huge variety of colorful fruits and vegetables, whole grains like oats and brown rice, legumes like beans and lentils, and healthy fats from things like avocados and nuts. It's a way of eating that is packed with the nutrients that fight inflammation and support that crucial inner lining of your arteries.
So, we've covered the internal strategy with diet. Now, let's shift our focus to a critical external strategy, the daily, practical care that's needed to prevent serious complications, especially when it comes to your feet. And here's why this is so critical. When the blood flow to your extremities is poor, your body's ability to heal itself is seriously compromised. Your feet are the furthest points from your heart. They're the end of the line.
So for them, this means something as simple as a tiny cut, a blister, or an ingrown toenail can fail to heal properly and can quickly escalate into a dangerous infection or a non-healing ulcer.
This is exactly why a daily foot care routine isn't just a good idea, it is absolutely essential. So step 1, inspect your feet every single day. Look for any changes at all. Step 2, keep them clean and, just as important, keep them completely dry, especially between your toes. Step 3, think of your shoes as your armor. Always wear comfortable, well-cushioned footwear. Never, ever go barefoot. And finally, be gentle. Cut your toenails carefully and avoid extreme hot or cold temperatures.
We've covered a lot of ground here, from the risks to diet to daily care. So now, let's pull it all together into a simple, proactive plan that you can use as a starting point for a chat with your doctor.
So here are the crucial takeaways. First, be aware of that surprising vitamin D connection and maybe talk to your doctor about getting your levels checked. Second, embrace a whole food plant-based diet as a powerful tool to heal your arteries from the inside. Third, make that daily foot check a non-negotiable habit. And finally, remember that all of this works best with 2 other pillars of vascular health, staying as physically active as you can to boost that circulation, and if you smoke, know that quitting is one of the single most powerful things you can possibly do.
At the end of the day, proactive health is really built on small, consistent actions. It's not about being perfect overnight. So as we close this out, the question I want to leave you with is this. Looking at everything we've just discussed, what is one small, manageable step you can take for your vascular health starting today? Whatever you choose, know that you're taking a positive step forward. Thanks so much for joining me.